So Liz, thanks for joining me.
Sure.
So why don't you just give me an overview of the One Health program here at UNL and some of your partners and how that's going?
Okay, sounds great. Well, thanks, Derek, for the invitation. So One Health is based on the idea that the health of people, animals, plants, and our shared environments is interconnected. And we could think about diverse types of animals, domestic animals like our pets and livestock, as well as wildlife. And there are many things that link health across these groups. Anything from a virus that goes from animals to people, so a zoonotic disease, or issues of contamination in shared water sources, things like wildfire smoke that might impact air quality for all. And many times when we're thinking about these challenges, we focus on things like shared diseases because they can have such a huge impact on agricultural production and food security from local to global levels. So if we think about diseases that can move from animals to people, whether it's from wildlife or domestic animals, it's influenced by lots of different scales. So everything from the level of the individual person and how our immune system responds to a disease, to the local level of where we contact other animals and people and hosts like ticks and mosquitoes that can carry pathogens, the regional level where we see diseases move from urban areas and agricultural systems and natural areas. So when we think of these big health challenges, One Health is an approach that just brings together teams of people from different backgrounds and training and perspectives to be able to work holistically to tackle these big health challenges that can impact people, our pets, livestock, wildlife, plants, and the environments that we share.
And when you describe it, it really helps me think about it moves across all aspects of our land grant mission.
Yeah.
And we're having a lot of these things are really topical right now.
Mm-hmm.
We're dealing with a lot of things over the last 5 years, but then also currently associated with wildlife diseases moving into domestic species, and how does that impact our systems, and how does that impact the profitability for agriculture, especially in the state of Nebraska. So who are some of the key partners you work with, both in the ag and in the human and in the environmental space that you have in your network?
Yeah, so it varies. So we have a Nebraska One Health program, and the goal of the program is to build these teams, whether we're thinking about an infectious disease or some other shared health threat. And we try to bring together teams that are working on research approaches, on training approaches for our students at all levels, as well as outreach and engagement with communities who are often on the front lines of these big challenges. So to give an example, ticks and tick-borne disease are a really big concern in the state of Nebraska, and especially in rural communities where people are in close contact. We know that new tick species are moving into the state, and we know that new diseases like Lyme disease are becoming established in areas of Nebraska. So when we're thinking about a challenge like that, we have a big Nebraska tick network that takes a One Health approach, and we're very happy to have our program be working with other partners in that big network. And that includes people from across universities in Nebraska, both the NU system and Creighton University, but it also includes partners at the state level, so the Department of Health and Human Services, the Department of Agriculture, Nebraska Game and Parks Commission, and then in many One Health groups, we're also working with local public health departments or nonprofit organizations, and then directly with producers and communities themselves, because many of these challenges don't stay in the university. So even though we might bring together people from, backgrounds like human and veterinary medicine and animal science and agronomy and economics at the university, One Health really works to engage much more broadly with partners to think about how things are changing and how we can work together to address them.
So when it comes to other areas, say, for example, I've got some notes I'm thinking about. What is like surveillance and the role of surveillance of diseases play, especially kind of in that transition zone between wildlife and domestic species?
Yeah, I think that's a great question. So we know from the local to global level, there's a lot of concern about shared diseases. So a big one that has been in the news a lot lately and is on a lot of people's minds is highly pathogenic avian influenza, the H5N1 virus. So that's a virus that is hosted in wild birds, typically, especially waterfowl, but can cross over to domestic animals like chickens and cattle and can be present in agricultural production production systems. And that can also not only affect the livestock and their production and their health, but it can lead to exposure to farm workers who are in direct contact. So we think about it at a lot of different levels. What's happening in the wild bird populations? What's happening in livestock systems? What's happening with human exposure, with contact with any of those groups? And then avian influenza, we can think about it, it causes really big problems in agricultural production, but it also has an impact globally on conservation. There are a lot of wild birds and animals like elephant seals that are having conservation challenges due to this. So when we think about all of those different spheres, we want to understand what's happening in the wild hosts. We want to understand how the spillover is carrying the virus from wildlife to domestic animals, and then how people might be at risk too, because we know that, influenza viruses can go from animals to people, but sometimes they can change and also spread from person to person. And so this is a beautiful example of the need for One Health, because again, no one person and no one research area can understand all those aspects. So by bringing together people who are working on human surveillance and domestic animal surveillance and wildlife surveillance, we have a much better understanding of what's happening in Nebraska, but what's happening globally that can influence local agriculture as well.
Thanks. This really speaks to the importance of the partnerships.
Yeah.
It also speaks, as you were talking, I was thinking about, with the example of the avian influenza, we have urban and rural areas impacted with the increased number of backyard eggs production, in addition to large-scale production. And we have to have all those partnerships for everybody to understand. And I guess it also speaks a little bit to food security.
Yeah,
and could you talk to me a little bit about then how One Health and food security are interrelated?
Sure, I think there are a lot of pathways. In the example of avian influenza, we know that when animals are impacted by that virus, cattle, for example, you can see declines in health and production, so like milk production with cattle, which of course is impacting not only the animals, but the livelihoods of the agricultural producers as well. We also know that when farm workers get sick or other people in the livestock production chain get sick, that has a huge impact on health and livelihoods, not the individual alone, but the health of the greater system. And so when we think about food security in Nebraska, or we think about food security globally, these shared diseases are often pointed to as a major concern. And that's why even at the global level, organizations like the World Health Organization, the FAO, or Food and Agriculture Organization, and the United Nations Environmental Program are all calling for One Health approaches to understand these really complex health challenges.
And when you think in that global perspective, it also makes me stop and think about sustainable practices in agriculture. And a lot of our producers are really skilled at sustainable practices for ag production. So how does One Health fit into that sustainable farming piece?
Yeah, I think there are a lot of broad connections. So, one thing I love about Nebraska is that I think there is this deep love of the landscape across all of the farmers that I've met, and a connection to the animals that are being raised, the wildlife around us, the plants, whether they're crops in production or trees in farm systems. And so I think that link to the land is reflected in people wanting to have systems that protect the landscapes around them. So whether it's the quality in a local stream or whether it's habitat for wildlife. And again, like the connection between people and wildlife and domestic animals is so impactful for the health of the farm systems and for the production of animals and crops, that I think thinking holistically about how we manage farms and how we interact with the natural areas at our borders, with the houses embedded in those farms, has a really big impact on the system as a whole.
Yeah, I keep coming back in my thoughts about the land-grant mission and how this is so important for teaching and learning, research and discovery, and extension and outreach. And it really fits in all those areas because it's lifelong learning for all of our communities, but it's also discovery and research, and how do we get that information out through our extension networks. Is there anything else you'd like to share with me about One Health and opportunities to be involved and opportunities you see for growth in One Health?
Sure. Well, one of the things that I love many things about working in One Health, but we have a lot of interaction with students, and some of that is out in agricultural landscapes, of course, in the state, and working with everything from wildlife that can be sentinels of disease or contamination to, working with our partners in pollinator health and the health of honeybees and other pollinators that play such a vital role in agriculture, and then working with our human health partners at UNMC and other institutions. And so having students have the opportunity to train across all of those areas when they're thinking about the plants, the animals, the people, and the ecosystem as a whole is a really exciting place to experience, to be, whether we're sampling tadpoles in a farm pond or whether we're looking at vegetation that feeds the bees that then are involved in pollination. Having students train more across a variety of disciplines and working with communities is a really exciting area. So we're trying to continue to build those experiences for undergraduate students, for graduate students. And then I really love art and science collaborations. So we've been working very hard to build connections with the Hicks and Lead College of Fine and Performing Arts at UNL, as well as other artists and storytellers, to ask how can we use even broader approaches to, bring in kids who will be the future of health decisions. So not only do we bring, the sciences lens and the social sciences, we're really trying to broaden it out to learn from the arts and humanities and to come up with creative new ways to explore how health is connected.
A great way to reach out to other communities and really make connections.
Yeah.
So thanks so much. I mean,
Sure.
this just understanding the comprehensive nature and how you're working across the UNL, but also across the entire university system to make these partnerships. And then you're reaching out also to the communities to really get this information out there. It's so important for agriculture. It's so important for public health. Really fits within our mission. So thanks so much for all you're doing, and thanks for joining me today to share more about One Health.
Yeah, you're welcome. I think one other thing that I would like to mention is that One Health is a collective approach. You've heard me talk a lot about different partners and teams, and I think that's really exciting for the future of Nebraska, the future of our agricultural systems and livelihoods. And so as people are thinking about One Health, we're very happy to engage and talk to communities and have community partnerships, and we're trying to do a better job of that. And I think that one thing that was really going to be wonderful in the future is that thinking about how thinking broadly and working together, we have a much better opportunity to protect the health of all.
Excellent. Wow.
So,
thanks so much.
Yeah.
Appreciate all you're doing.
Thanks.
This is a great program.
Thank you.